Hey there, health enthusiasts, and welcome back to Shock Doc Medical. I'm Dr. Rod, your friendly neighborhood doctor, here to break down some of the trickier topics in medicine with a dash of humor, a sprinkle of metaphors, and a whole lot of heart. Today, we're diving deep into the world of antihypertensive medications. Yes, those mighty pills and compounds that help keep our blood pressure from going haywire. Now, I promise this won't be your average snooze-worthy lecture. Think of it as a jam session where every note counts and even the dry topics get a funky remix. All right, let's set the stage. High blood pressure, or hypertension, as we call it in the biz, is like that uninvited guest at a party. You might not see it coming, but before you know it, it's there, making a mess of your cardiovascular system. The guidelines from the American College of Cardiology and American Heart Association, that's the ACC-AHA for those in the know, tell us that keeping your systolic pressure under 130 millimeters Hg is key. Why? Because that magic number helps prevent complications from heart failure, diabetes, coronary artery disease, and stroke. It's like having an all-access pass to a healthier life. Now, if you're wondering where we draw the line between just a bit of pressure and trouble, here's the lowdown. Normal blood pressure, systolic less than 120 and diastolic less than 80. Elevated blood pressure, systolic 120 to 130 with diastolic still under 80. Stage 1 hypertension, systolic between 130 to 139 or diastolic 80-89. Stage 2 hypertension, systolic at least 140 or diastolic at least 90. Hypertensive crisis, when things go super off the rails, systolic over 180 and or diastolic over 120. It might sound like a lot of numbers and percentages, but trust me, these aren't just arbitrary figures. They're like the GPS coordinates guiding us away from a cardiovascular disaster. Let's start with the big players in our antihypertensive ensemble. First up, we've got our trusty thiazide diuretics. Imagine these as the dependable workhorses of the medication stable. Their job? To help your kidneys kick out excess salt and water. Think of it as clearing out the clutter in your pipes so your blood can flow smoothly. And while hydrochlorothiazide has been the poster child for a while, studies have shown that thiazide-like diuretics, specifically chlorthalidone and indapamide, pack a stronger punch. Chlorthalidone, in particular, has been hailed as the rock star here, reducing systolic blood pressure more effectively and even cutting down on cardiovascular complications. It's like comparing a tricycle to a turbocharged sports car. Next in our lineup are the calcium channel blockers, CCBs. These medications are the smooth talkers, relaxing your blood vessels like a gentle massage after a long day. There are two flavors here, dihydropyridines like nifedipine and amlodipine that are more about vasodilation, and non-dihydropyridines that play a dual role by also affecting heart rate and contractility. Picture dihydropyridines as the chill DJs at your blood vessel party, ensuring everything flows smoothly, while non-dihydropyridines handle the more complex beats of heart rhythm. Now, if our playlist needed a superhero duo, enter ACE inhibitors and ARBs. These two classes are like Batman and Robin, each with their own unique skills to lower blood pressure and protect your heart and kidneys. ACE inhibitors work by blocking the enzyme that turns angiotensin 1 into the notorious angiotensin 2, which is a real troublemaker when it comes to narrowing your blood vessels. ARBs, on the other hand, block the receptors that angiotensin 2 would normally target. They're both stellar choices, especially in patients with chronic kidney disease or heart failure. But with a twist, ACE inhibitors can sometimes trigger a pesky cough, so ARBs are often the go-to alternative for those who'd rather not sound like they've got a permanent cold. Then we have beta blockers. Now, beta blockers aren't usually the first line of defense in treating hypertension unless there's a specific reason, like a history of myocardial infarction or heart failure. They work by slowing down your heart rate, kind of like easing off the gas pedal when you're driving downhill. However, they can sometimes lead to side effects like fatigue or even a touch of depression, so they're used judiciously. But what if one drug just doesn't do the trick? That's where combination therapy comes in, a bit like assembling the Avengers. When monotherapy, using one medication, falls short, combining medications from different classes can be significantly more effective. Research shows that adding a second drug is like turning up the volume on your favorite song. It can drop your blood pressure about 5 times more than simply doubling the dose of a single medication. And if 2 just aren't enough, sometimes you add a third or even a fourth, especially when dealing with resistant hypertension. Now, let's not forget that with great power comes great responsibility, and that means being aware of the potential side effects. Every medication has its quirks. For example, while thiazides are fantastic at shedding excess fluid, they might also lower potassium levels, which can be a bit like accidentally removing too much salt from your soup. Calcium channel blockers, on the other hand, might lead to some peripheral edema. Imagine your ankles saying, "Hey, we're a little puffy today." And ACE inhibitors, as I mentioned earlier, can sometimes cause that notorious cough. Monitoring is key, folks. It's like keeping an eye on your car's dashboard. Regular checkups, lab tests for electrolytes, and blood pressure measurements ensure that everything is running smoothly. And here's where the magic of teamwork comes into play. An interprofessional team of clinicians, nurses, and pharmacists is essential. They're like the pit crew in a high-stakes race, constantly monitoring for any hiccups and adjusting the treatment plan on the fly to ensure you're cruising safely. What I love about this whole conversation is that it highlights how uniquely human our interactions with medicine really are. It's not just about crunching numbers or following rigid guidelines. It's about understanding the story behind each heartbeat, each measurement, and each medication. Human conversation is a symphony of emotions, gestures, and context, and the way we talk about and manage hypertension is no different. The article by Hassan Khalil and Roman Zeltzer, updated in May 2023, lays out not just the what and how of antihypertensive medications, but also underscores the importance of an individualized approach. It's like each patient is a unique melody, and our job as healthcare providers is to fine-tune the harmony between medication, lifestyle changes, and vigilant monitoring. Imagine if every doctor, nurse, and pharmacist worked together like a well-rehearsed band. The clinician writes the score by initiating the antihypertensive regimen. The nurse monitors your day-to-day performance by checking your blood pressure and ensuring you're following the plan. And the pharmacist makes sure there's no discord, like dangerous drug interactions, messing up the beat. That's what optimal healthcare looks like. A beautiful, coordinated symphony of care. So, to wrap things up in a neat little package, if hypertension were a bad date, these medications are your ultimate wingmen, ensuring you don't end up with heartbreak and a hospital bill to match. Whether it's the reliable thiazides, the smooth-operating CCBs, the dynamic duo of ACE inhibitors, ARBs, or even the carefully selected beta blockers, each class has its own role to play. And when monotherapy isn't enough, combining these medications can transform your treatment plan from a solo act to a full-blown orchestra performance. Remember, the goal here is not just to lower numbers on a monitor, but to protect your heart, your kidneys, and your overall well-being. And that's why it's so important for us to keep the conversation going about our treatments, our lifestyles, and our healthcare teams. That's it for today's deep dive into antihypertensive medications. I hope you enjoyed this mix of science, stories, and a few laughs along the way. If you found this episode as energizing as a double shot of espresso on a Monday morning, please hit that subscribe button, leave a comment, and share this podcast with anyone who could use a little extra heart-smart advice. Until next time, this is Dr. Rod on Shock Doc Medical, reminding you to keep your blood pressure in check and your heart singing. Stay healthy, stay awesome, and as always, take care of yourself.